My name is McCluskey. I'm a Professor of Ophthalmology at the University of Sydney. I'm the Director of the Safe Sight Institute, and currently I'm the President of RANSCO. The critical contribution that AVR makes is that it provides the seed funding for young investigators. I got multiple grants from the predecessor of AVR, Aurea, when I was a young clinician scientist. And basically, it was one of the few places that was prepared to take a risk and let you investigate a new area, look at something that no one else had looked at. And it gave you just that little bit of working research funding to let you try out your ideas. And certainly, you know, those small grants have been repaid tenfold in subsequent research grant funding that have been enabled by that seed funding from AVR. So it's a really critical place to help people start their research careers. It's critically important that AVR continue to help young researchers and to provide that critical seed funding. But I think there's two areas that really I think are going to become key areas for research. One is, I suppose, broadly what we call personalised medicine, which is accurately working out what the problem is and then using a particular specific treatment that's specific for that patient with that disease. We already do that for chemotherapy now for many malignancies. And it's going to increasingly become useful for inflammatory disease and gene-related disease. And the other area, of course, is AI, artificial intelligence, and we're going to have to embrace that and use it to our advantage. I think there's a famous sort of saying that the basis of good medicine is good science, and that's what really, you know, drives clinical medicine. Our research, not only in ophthalmology, but in medicine in general, is driven by unmet clinical need. So we see a patient, we don't have a treatment, we don't understand the disease. So we go back to the research lab and we try and determine what the pathology is and what's the pathophysiology. Once we understand the basis of the problem, that then gives us the opportunity to work with our scientist colleagues and our basic science vision researchers to develop new specific interventions that will target that disease. And we've done that successfully on a number of occasions here in Australia. We've helped to pioneer intraocular therapy for macular disease. We've developed specific therapies for other diseases, helped to pioneer a treatment for macular telangiectasia, and we've got a very active number of groups working on specific new therapies for genetically determined eye disease. So it's really important that we have adequate funding to be able to keep driving that research. Well, I think AVR was developed by ophthalmologists who had a desire to give back and to promote research, and it continues to be that way. You know, the most of the research is done by ophthalmologists and their science colleagues in Australian universities. And the fact that the organisation is run by ophthalmologists for vision research really differentiates it from other organisations and shows the commitment of ophthalmologists and ophthalmology to want to give back and to improve the outcomes for our patients. AVR was started by ophthalmologists. It's always been run by ophthalmologists. It's one of the two most powerful research organisations that fund ophthalmic research and basic vision science research in Australia. I think it's important that all of us as ophthalmologists support our colleagues who are clinician scientists and that are trying to help to solve the unmet clinical needs of blindness in our community. And we've made enormous strides with the help of AVR and AUREA, its predecessor, and I think it's critically important for our future as ophthalmologists to continue to support AVR to make sure that we give our patients the best outcomes.